Ganeslen's test is a pain provocation test often utilized in combination with 4 other provocation tests to rule in or out dysfunction of the sacroiliac joint region. Indications to perform the Ganeslen's test include a sharp pain or general ache over the sacroiliac joint region. This pain will typically not radiate into the low back or down below the knee. However, referral into the buttocks is common. Neurological signs are often absent. However, entrapment of the S2 nerve root may occur as the nerve root passes through the sacral sulcus or along the long dorsal ligament. Other indications include tenderness to palpation of the sacroiliac joint line with normal hip and lumbar range of motion. Contraindications to the performance of Ganeslen's test include a total hip arthroplasty, a hemiarthroplasty, any situation where hip precautions are in place for the patient, pain that has already been localized to the hip or lumbar spine region, or a recent femoral fracture. In regards to psychometrics, Ganeslen's test demonstrates a 53% sensitivity and a 71% specificity. Ganeslen's test places stress bilaterally across the sacroiliac joint, inducing posterior innominate rotation of the hip that is being flexed and anterior innominate rotation of the hip that is being extended. Other structures placed on stress include the sacroiliac ligaments, the pubic symphysis, and potentially the femoral nerve. During performance of the Ganeslen's test, the patient is positioned supine with one hip extended over the edge of the table and the other hip flexed to the patient's chest. A flexion moment is applied by the examiner to the flexed hip, while a counterpressure is applied to the extended hip. The test should be repeated on both sides. A positive test occurs when the patient has reproduction of his or her unilateral or bilateral sacroiliac joint pain. The examiner can also glean the end feel and the pain resistance sequence while performing this test. When evaluating the data from the performance of the Ganeslen's test, the examiner can help determine if there is a soft tissue sacroiliac ligament sprain, joint irritation, and determine the acuity of the lesion. Potential interventions can be derived if the pain experienced by the patient changes based on the respective anterior or posterior rotation of the innominants when the test is performed bilaterally. The test can be ruled as negative if no reproduction of the patient's symptoms occurs. Let me just finish up washing my hands here. Hi, my name is John Avila. I'm going to be your physical therapist today.
Sounds good. I'm Julie Ermolov. Nice to meet you.
Nice to meet you, Julie. So what brings you here today?
I have some pain in my low back area over here.
Okay, if you could maybe just swing your legs around and so your back is facing that way. Do you mind if I just touch your low back with my hand real quick? So it sounds like you said that your pain is in what's called your SI joint, your sacroiliac joint. And that lies right here on your back. And so I'm going to do a provocation test. It's called Ganeslen's test. That is one of 5 tests that I'm going to be doing today to determine if your SI joint is the location of the symptoms you come here today complaining of. So for Ganeslen's test, if you could lie down on your back, please. And then scoot towards me just so your hips just at the edge of the table. Perfect. And then if you could bring this leg, this knee up to your chest. Great. And I'm going to now drop this leg off the edge of the table. And I'm going to apply a flexion force to this flexed knee and an extension force to the extended knee. And I want you to know if at any point you have a reproduction of your symptoms, okay? Any reproduction of your symptoms?
No.
All right, we can go ahead and relax now, and that will be repeated on the other side now. If you could scoot towards the other side of the table. Perfect. And can you bring this knee up to your chest? There. Grab this knee off the edge of the table. And do you have any reproduction of your symptoms?
No.
All right. So, When I brought your legs up to their end range and felt a good end feel and you had no reproduction of your symptoms, that should suggest to me that the test is negative. So I will go on to perform other tests to either rule in or out dysfunction of your sacroiliac.